One of the things we like to do at CCIH conferences, and now I'm speaking kind of as a board member as well as a co-chair for the Family Planning Working Group, is see how our constituency, our members, react to new areas. And we've done this sequentially. Those of you who have been to several CCIH meetings, that this whole area of family planning has been one that we've approached with great care, and we hope sensitivity and openness to the feedback from all of you, and we've gotten a lot of that. A new area that we've been invited to participate now in is an interfaith effort, with particularly in partnership with Muslim organizations and in cooperation with the German World Population Fund. So those of you who have the handout, this briefly describes the three organizations who are sort of the core partners who have already met twice, and coming up very soon, we will have a larger gathering in Nairobi the end of this month, so it's coming on us quite quickly, to look at the feasibility of a global advocacy campaign that is interfaith in orientation. The steps in this process that are generally outlined in that descriptive document are to bring together faith leaders across a broad spectrum of faiths and to see what common areas there are in relation to family planning as an integral component of health, not as an explicit initiative, but to make sure that that component is understood, is supported in relation to its importance for family health and comprehensive health care. The three organizations that are partners, the German World Population Fund, located in Brussels, and it has offices in a number of developing countries, also has a project called Euro Leverage, in which they work with European donors, particularly the European Parliament, which is literally right across the square from where their offices are. So that's part of the strategic thinking that went into this partnership. The European community would become more engaged. So that's one element. CCIH was invited because of our broad Christian constituency, and Muhammadiyah, which is the progressive Muslim organization in Indonesia, the largest Muslim country in the world, and their orientation that also serves a wide variety of faith communities, even though Indonesia is predominantly Muslim. They also work with Christian groups and serve Christian communities. As I know, many of we in our Christian health services also serve Muslims and other people of other faiths, and do that as part of our commitment. So these three core partners of ours, we three core partners, have been engaged with the planning towards and now incorporating religious leaders and institutions into what will be a consultation in Nairobi that will be addressing what a consensus would look like that would then lead to a more elaborate campaign and to start working out some of the details of what the messaging and the issues of that campaign might look like. We heard two excellent presentations just a few minutes ago, on how you shape and plan messaging, and your focus and your goals for a campaign. All of this is still to be done by the people who are going to be assembling there. But as things move along, one doesn't want to start out from scratch. So I'm going to share with you a few of the points of what our core partners came up with that we think might be a suitable statement for this larger consultation group to grapple with, to see how it resonates with you, and to give you a sense of where we're thinking this is going. So this is, and I'm not sharing it because this will obviously be changed, modified. Yes?
I don't think your computer's hooked up to the projector.
I'm sorry?
He doesn't have a PowerPoint.
No, this is not. So I'm sorry. Thank you. No, you're just supposed to be looking at me, even though she's more attractive. So this is a draft draft statement, such as it is, that we kind of crafted among ourselves. We trust with humility and deference as it gets probably torn apart, reshaped, whatever our colleagues decide to do with it. From faith to action on reproductive health and family planning, a draft consensus statement by faith-based leaders for the global campaign for family planning and reproductive health. Health is a universal right for human beings and a universal value by all faiths. Given this, faith leaders and communities have an important responsibility to promote and protect health and provide the means to be healthy. Recognizing family planning is integral to health and well-being, we faith leaders affirm the importance of family planning services to enable couples to determine their desired timing and spacing of children. As religious leaders, we respect the choice of individuals based on their own faith and needs and recognize the relationship between family planning, health outcomes related to women's and children's health, access to information about the methods of birth spacing and family planning for pregnant women and new mothers, and to achieve the Millennium Development Goals. As leaders, we acknowledge that family planning helps women and couples to plan, space pregnancies, reduce abortions, lower infant, child, and maternal mortality. It helps reduce poverty and improve household prosperity. As leaders, we recognize that religious institutions and faith-based organizations hold tremendous power and influence on public policy and people's trust that they are major service providers in health and education. The unique combination can leverage the power of their communities and influence donor and government policies and funding. Indeed, in some contexts, religious leaders are political leaders, faith leaders, service providers, and donors, wielding both influence on faith, policy, and services. Individually, religious institutions and faith-based organizations have achieved great impact in health outcomes. The collective partnership by religious institutions and faith-based organizations can amplify the impacts on family planning and reproductive health funding and policies. As religious leaders, we commit to collaboration while recognizing and respecting the differences in faith and their positions. This consensus statement is an affirmation of the collective commitment by champions across faiths on the importance to advocate for increased priority and support for family planning and reproductive health. This statement identifies shared objectives, values, global goals, and common messages, and defines conditions under which the groups can work together as a voice for family planning and reproductive health advocacy. As religious leaders and faith-based organizations, we support universal access to family planning and reproductive health and commit ourselves to a global call to action in support of family planning and reproductive health. And the objective then is to have as many individuals and institutions sign on to this document, or whatever changes they make in it, in terms of them going forward with a proposal that would then fund a larger global advocacy effort. I think for us in CCIH and Mohammedia and the German World Population Fund, for starters, some of the issues to be sorted out is, okay, then who is going to do what and how does that start taking on flesh and reality? The German World Population Fund has staff who are quite experienced in global advocacy campaigns of various sorts related to other health issues. So we have some capability there. The kinds of leaders who have already responded to our request for participation in this are people, some of whom we know closely, like Dr. Samuel Mwenda, who is the coordinator for the African Christian Health Association's platform, these 26 countries that Devina just described, those networks, each of which has several hundred, or sometimes many hundred, of Christian organizations working in their own countries. And many of you are among that group that are also part of their network. So this is looking at how we, for example, in CCIH might work with the African Christian Health Association's platform to use their networking to engage these country-level networks to engage their governments and donors. To make this a little bit more practical and real and time-sensitive, yesterday we had some rather extended discussions with one of our members, Christian Social Services Commission of Tanzania, one of the countries where we're also working with Institute for Reproductive Health. And their director is here, Dr. Adeline Kamambo, about whether they would be interested and whether this is important for them. And it became quite clear that these kinds of issues and how they access resources and provide services in relation to their government and donors is important. They would be willing to do so and eager to engage in this. So as we move forward, we need to start putting together many of the pieces in place that would start bringing action that will make a difference. And just to build on, how am I doing for time? Over? Building on one of the points that Lauren made with that really excellent consultation that IRH sponsored at Georgetown University. One of the points that our German World Population Fund colleague came home with is much of this kind of advocacy is actually local. It doesn't lend itself very easily to a global campaign, with one message. That Tanzania is different from Malawi, is different from Bangladesh and Indonesia and Egypt. So that we may end up having more direction going to the country level in the context of this global campaign. So these are some of the tensions that are surfacing as we begin to understand and build on the good work that IRH has done in this important consultation, and as we move forward with our partners and the leadership that comes together in Nairobi in another few weeks.